This is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is avoiding surgery for degenerative disc disease. Here's a look at a normal intervertebral disc. It's composed of 80% water and 20% collagens and protein. So the best analogy is that of a jelly donut. So the outer part of the donut is here called the annulus fibrosus, and the inner gelatinous part is the nucleus pulposus. So the nucleus, the jelly, has no nerve endings whatsoever, so this can't produce pain. However, the outer part of the donut, the annulus, does have nerve endings. So if you have some degeneration, some tearing out here, you can see some back pain in an individual. Normally this disc, when it's healthy, acts as a great shock absorber. Walking, running, jumping, the water gets pushed out with stress absorption, and then it comes back in. So when you start to get degenerative disc disease, the essential problem is that the disc is losing water. And as this occurs, what you can start to see is that a healthy disc starts to look like this, where you lose height, you get some degenerative changes, arthritic, and you can start to get some disc bulging, kind of like a flat tire that's getting flat, starts to bulge. Okay. Now, when a person has back pain, 40% of the time it's coming from a problem in the disc. This can lead to inflammation and irritation of the adjacent nerve roots as well. That's why with degenerative disc disease you can sometimes see sciatica. So it may lead to completely disabling pain every day, or it may be completely asymptomatic. There was a study looking at MRIs in patients between the ages of 20 and 50 who had no back pain whatsoever. And what they found is that over a third of them had signs, like you can see here, of degenerative disc disease and no back pain whatsoever. So if a person does have chronic back pain as a result of disc problem, what are the treatment options? Well, first and foremost, over-the-counter medications such as Tylenol and anti-inflammatories can be extremely helpful. For acute exacerbations, maybe some narcotics and muscle relaxers. There's also some topical medications that can help right on the back. Physical therapy can be great, especially with stretching and strengthening, with core strengthening, along with ultrasound electrical stimulation. Chiropractic treatment with manipulations can be great. TENS units are inexpensive devices about the size of an iPod. They run off a battery, and they have little foam pads that go over the back, and they can help reduce pain. As you can see in this picture here, spinal decompression therapy is an intermittent traction device that's computerized, and it can relieve pain for months at a time. It has over an 85% good to excellent results. And acupuncture. When it comes to interventional treatment options, first thing is trigger point injections in the low back. Those can decrease aching and spasms significantly. There are some studies looking at intradiscal injections of steroid medication. That's been shown to help for months at a time, and then it can be repeated. When a disc itself is getting degenerative, a lot of times the stresses in the spine go towards the back of the spine where the facet joints are, and that can cause pain and arthritis back there. So a facet injection, a medial branch block, and then a subsequent radiofrequency ablation may provide months to a year and a half of pain relief. And as mentioned previously, if you have some inflammation of adjacent nerve roots from the disc problem, epidural injections can help. Very quick word on IDET, intradiscal electrothermal treatment. Studies showed that it didn't work as well as initially thought, so insurance companies really don't pay for it anymore, and you rarely see it being performed. MILD stands for minimally invasive lumbar discectomy. Some pain doctors will take out part of the disc to try and relieve pressure from the degenerative disc disease. Here's a picture of a radiofrequency ablation. You have the back of the spine here, spinal joint over here, and the coil is coming in, the catheter, and it's heating up these little nerve endings, supplying sensation to this joint, deadening that. That can provide pain relief for 15 to 18 months, and then it can be repeated. One of the latest treatment options are stem cell injections into the disc. There are plenty of studies being performed. So far, so good when it comes to this. What you can have is either bone marrow-derived stem cell injections, amniotic-derived stem cell injections, or fat-derived stem cell injections. So they are being performed with hard-to-heal wounds, degenerative arthritic joints, and now they're being performed into the intervertebral disc. And so far so good in the small case studies. When it comes to outcomes, there was a paper in the World of Neurosurgery that showed that there really was no difference when it came to long-term outcomes for those with back pain who had a positive discogram in that disc, so they did have degenerative disc disease. When they looked at surgery versus non-surgical treatment, there was no difference. So the ones who didn't have surgery obviously avoided the risks of those procedures. 75% of the time, patients are able to achieve a satisfactory level of baseline pain without surgery for degenerative disc disease. Arizona Pain Specialists has the most comprehensive pain management doctors in the Valley. There are 6 locations. They really are a one-stop shop. They have board-certified, award-winning pain doctors, chiropractors, PT, rehab, acupuncture, spinal decompression therapy. There are patients, they've won the Patient's Choice Award 5 years in a row, and they accept over 50 insurances. So call today for scheduling at 602-507-6550 and visit us on the web at preferredpaincenter.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.